the option to stay in the room. And I hit the right button, which is good because I have at one time hit leave meeting when I was leading it. So for today's conversation, really wanted to, first of all, we want to acknowledge we sent the full report as well as the executive summary that HealthierHere received from our consultants around the care coordination landscape analysis. And we did that just for transparency. We wanted to be, if it's useful to you all in your work as you are thinking about how to structure programs or even to seek additional resources or to fill gaps. And we also know that it's a dense document. And so we wanted to provide opportunities to share some high-level findings from that landscape analysis and to provide an opportunity for discussion with our partners. And this is not a one and done. You'll hear throughout the conversation today that we have plans to continue to iterate on this with our partners throughout the next several quarters. As it relates to the care coordination landscape analysis, we will be sharing some of the work that HealthierHere is doing as it relates to some of the findings and recommendations that emerged out of the analysis that was conducted. And we also want to provide space to fill some of the gaps that we know are still in the information we have, specifically kind of provide opportunities for you all in the room to share with us as well as everyone else, because we'll do a summary about the great work that you are already doing, as well as the work that you think needs to be done related to care coordination. And then we'll end with an opportunity for some folks to hopefully express interest in joining HealthierHere in a little bit of a deeper dive with us as we continue to kind of think through how do we want to transform our care coordination system within King County. So we will hopefully have some opportunities with a smaller group, as well as in the future continue to bring these larger convenings together to share and learn from each other. And with that, I will pass it off to Madeline McCaslin and let her share with you and lead and facilitate the rest of today. Thanks.
Great. Thank you, Michael and Maria, for that lovely introduction. Alrighty, so if you have not already, I would like to invite you to share in the chat your name, your preferred pronouns, your organization, and also one word that comes to mind when you hear the term care coordination. So if you've not done that, please do that in the chat. And as you do so, I just want to elevate some of the responses we've gotten already. Words like harmony, collaboration, accompaniment, more collaboration and partnership, recognition, action, connection, services. Lots of really, really great words that are coming to mind. So really appreciate everyone sharing. It shows us there are lots of different things that come to mind when we hear care coordination. And hopefully today we can do some more grounding in that work and some alignment, but really appreciate what you're all already bringing to the table. So as we head into the conversation today, I think it would be helpful to start with a bit of a definition of what care coordination is. As I said, many terms come to mind, as you can see in the chat, when we talk about care coordination, and perhaps there are different concepts and definitions that we think about. So I'd like to provide us just at least one definition that we can use today to center us. So I'd like to share the community-based care coordination vision that's been shared between ACHs across Washington State, and the Healthcare Authority. So this vision states that community-based care coordination reduces fragmentation and improves access, coordination, and support for individuals and families across the care continuum. Community-based care coordination can help providers manage the transition to value-based care, but it is broader than just medical care coordination. So this acknowledges that care coordination is really locally based and involves addressing those social determinant of health needs, or as you might already be referring or hearing the term, health-related social needs. So you might be hearing that as well today, and that is similar to addressing those social determinant of health needs. And this vision is really predicated on the value that everyone in Washington State should receive the care coordination support that they need to really reach their full health potential. And so this is the vision that we're going to be using to guide us today, but I also want to acknowledge that as we start talking about some of the gaps and challenges we know to be our current realities when it comes to care coordination, that sometimes this vision isn't fully realized due to those challenges. So we also acknowledge that today and hold that as truth. So we do want to spend some time diving in a little bit to the care coordination landscape analysis. As Michael mentioned, you should have received both our executive summary and the full report. So if things come up that are interesting to you today, definitely refer you back there to do a bit of a deeper dive, but we'll hit on some of the highlights today. So to give you some context, this was a project that HealthierHere did with Mathematica and Comagine Health. And it was really an effort on our part to address these three questions that you see on the screen here, which was to get an understanding of the current status of care coordination in Washington State, but also specifically in King County, to understand those facilitators, challenges, and gaps that really characterize our current state, and then also start to understand what it's going to take and where we need to focus our energy and capacity to improve the system and improve equity as it relates to care coordination. So this was done through several different methods, including a co-design workshop, document or literature review, interviews and focus groups, and a survey of almost 100 people. So many of you perhaps had the opportunity to participate and contribute to this analysis. So our hope is that today, if you were able to participate, you're seeing some of those thoughts and that input reflected back. And then if you weren't able to participate, that you're seeing just briefly some of that current state and those challenges that we're facing related to care coordination in King County. As far as who contributed to the landscape analysis, we had a variety of partner types, including community-based organizations, tribal-led and tribal-serving organizations, patients and consumers, government representatives, behavioral health agencies, substance use disorder organizations, and managed care organizations. Across our partners, they were serving wide ranges of populations, and those included, but aren't necessarily limited to, folks experiencing health disparities based on race, ethnicity, culture, language, immigration status, gender identity or sexual orientation, those experiencing low income, mental health diagnoses, homelessness or unstable housing, or substance use disorder. And again, those who participated ranged in their roles from administrators to care coordinators or navigators, social service providers, so those actually providing care, and then also patients and consumer advocates. So one thing that came out of the landscape analysis that we want to emphasize was some of the strengths of our current system. So what we saw was that providers really are passionate about delivering patient-centered and culturally responsive care coordination. And not only providers, but leaders and as well as staff are really committed to doing this work in a collaborative way. We saw that even though there are a certain number of challenges and gaps in the current system, our workforce is extremely knowledgeable about those realities that we're facing and have also gotten extremely creative about meeting their clients' needs in the face of those challenges and gaps. And part of the way they've done that is through established connections, not only with clients, but entire communities, and then also external partners with whom they're working with to refer clients or meet client needs. So again, leaders we saw are really committed to doing this collaborative care coordination work. And that was reflected specifically in the survey, where most people agreed that their leaders are committed to doing this across working with different organizations. However, fewer respondents and organizations agreed that they're consistently communicating and coordinating with a wide range of providers. And also fewer agreed that they have the resources needed to do this work. So we started to see a little bit of that gap between this commitment to doing this work and having the resources and ability to actually make that a reality. So a little more about the current state. So we saw, so again, speaking to that gap between this commitment to care coordination and making that a reality, not only did we see the commitment, but also a desire to make improvements to the system and to patient-centered care. We also saw that most survey respondents felt that their organizations had the right partnerships to address whole person care needs. However, fewer knew exactly where to send referrals to external organizations. And then even fewer than that are doing that consistent follow-up to confirm whether clients received the services that they needed. And then even fewer than that, only about a quarter of folks who took the survey said that they're receiving that closed loop feedback after making a referral. And then lastly, a challenge I'll touch on is that we heard from a lot of folks that are doing this care coordination work, that they're having to use multiple platforms to track referrals. And often they're using 4 or more electronic systems. And they shared that specifically that burden of having to use multiple systems really reduces their capacity to actually do this work. So want to elevate that. So what the findings really culminated in were these 6 recommendation areas that you see on the screen here. And these are the areas where we can potentially focus more of our capacity and energy to actually improving the care coordination systems. And those recommendation areas are a CIE, which stands for Community Information Exchange, and data sharing. So specifically, implementing solutions that work with our current technologies and systems, but also promoting changes to improve technology and really contribute to interoperability. A need to focus on cultural competency so that our workforce is diverse and able to provide that culturally responsive and tailored care. a need for community engagement, which really leans into community trust and actually building that trust through engagement, investment, and power sharing with community. We found a need for funding, unsurprisingly, and specifically diverse funding streams so that we can have sustainable financing that is also equitable. And we have a need for workforce, which speaks more specifically not only to building up the workforce in a diverse, equitable, and inclusive way, but also fostering those connections between existing members of the workforce and contributing to their development as well. And then the last one was policy, which speaks to really addressing these upstream root causes of harm and inequity that are contributing to the gaps that we're currently seeing in our systems, and really working to improve access on a policy level. So HealthierHere has actually had the opportunity to share these recommendation areas with a couple of our partner groups. And I want to share some of their reflections with you, as I'm sure that some of you are having similar reflections or thoughts as you hear some of this content. So some of what we're hearing is that all of these 6 recommendation areas, so the ones you see here, they are interdependent. So they can't really be thought of as separate. When we're working on one area, often it has trickle over effects into the others, and that they're really interwoven. So I want to acknowledge that we don't really want to be thinking of these necessarily as standalone areas. We've been hearing that community trust is really the cornerstone of this work. Without that trust, we really can't do anything else. We've heard folks want to elevate the components of cultural competency and community engagement. We've also heard, as it relates to diversity and inclusion, that we need to be thinking about this not only in who is doing the work, but how it's being done, and making sure that the way care coordination is being done is in diverse methods and responsive to community as well. We've heard elevation of funding, and that's similar to community trust. Without funding, we really can't do this work. And then as it relates to what might be missing from these recommendation areas, we've heard that advocacy needs to be elevated within the policy area, that evaluation and measurement are missing, and that we need a way to know that if this is all working. And then I'll specifically call out too, as we think about evaluation and measurement of care coordination, how do we do that in a way that is equitable and sort of decolonizes traditional evaluation practices. And then also have heard this need to call out training specifically as it relates to workforce, but really naming that as a specific need within the recommendations. So these are just some of the reflections folks are having. So if you're having similar thoughts, we want to know that, let you know that we're hearing those as well. So I do want to provide you some time and opportunity to engage in discussion about this content. So we are going to go into breakout rooms, and you'll have about 12 to 15 minutes in your breakout rooms to address the questions that I will share with you. There will be a HealthierHere staff member in each of your rooms to facilitate discussion and help with note-taking as well. So also to help guide your discussions, if it's helpful, I'm going to put a link to a Google slide in the chat so that you can reference those 6 recommendation areas as you discuss. If that's not helpful to you, feel free to ignore that, but it's there if you'd like it. So what are we going to ask you to discuss? Let's see. So the questions are, if you had a magic wand that could address any gap or area of need within care coordination, what would it do and where would you start? So as you think about this question, I want to acknowledge again that you don't need to pick one of those 6 areas, because often when you do one intervention, it can hit on multiple of those. So you can keep that in mind as you discuss. And I will put those questions in the chat for you as well, so you can reference them. All righty. So I'm going to have Maria send us into our breakout rooms, and then we'll call you all back when the discussion is over.
Fantastic. Enjoy. And just for all of the breakout leaders, you'll see on the Google Doc if your name may not necessarily correlate to the room. So just take a look at what room you're going to join, and then just assign yourself in your note taking to that space. That'll make sense once you get there. All right. We'll see you back in a little bit.
Hi, Madeline. This is Sarah.
Hi, Sarah.
Hi. Would you like me to go into the room, or do you want HealthierHere staff to stay out of the rooms?
If you can go ahead and join if you'd like.
Okay.
Yeah, you can go ahead and choose one.
I didn't have a thing pop up for me.
Oh, okay. Let me see who might need
Hello, April.
Hi, Mario. How are you?
Fine, how are you? Sorry, I'm joining late.
Oh, no worries. We are just popping into small groups.
Yeah, there's discussion questions in the chat, Mario. So do you want to go into a breakout room, or do you need some time
Sure.
to settle in?
No, send me to a breakdown room and maybe I just follow through.
Okay.
Okay, thank you.
Great. Did you get the pop-up, Gabriel? Okay, great. Buddy. Welcome back to the large room. Great. It looks like we've got everybody back here now. All righty. I'm gonna pop up our presentation again. So really hope that you had some rich discussions in your breakout rooms. We don't have time today to share out as a large group. However, what I'll do is sort of pull from the notes that our staff members were taking and pick out some of the themes, and I'll actually embed those in this PowerPoint slide deck and share that with you all after the gathering today so that you can hear some of the themes from other groups that you weren't in. Okay. So to continue on, so now that we've started talking about some of these challenges and gaps that we're seeing related to care coordination, I want to share just a little taste of some of the work that HealthierHere is doing and how it relates to addressing these recommendation areas. And as I'm sharing those things, I'm going to be asking you all to think about what your organizations are also doing around care coordination, and because we'll have an activity in a little bit where we'd love to hear from you all. So one work stream I'd like to highlight about HealthierHere's work is our Connect to Community Network and the use cases that our team is developing. And for those that don't know, the Connect to Community Network is HealthierHere's community information exchange, also known as CIE. And excitingly, they're working with a vendor to really build that technology infrastructure and data sharing capacity to work on that interoperability of different systems to really achieve this vision that you see here on the screen, which is to co-create a connected system of whole person care to strengthen the care coordination of those in need by connecting people, service organizations, and community partners more quickly and more effectively, resulting in a healthier, more equitable community for all. And how they're doing that is taking these independent, siloed systems that you sort of see here on the left and integrating technology platforms so that care team members are using fewer platforms. We heard that in the landscape analysis. Most of our partners are using 4 or more platforms. So working on that integration piece so that care team members and clients can really share their information and decrease that burden of having to do so in so many different places and at so many different times, so that everyone really has access to that up-to-date, comprehensive information. So we really see this work stream addressing the gaps related to CIE and data sharing, as well as community engagement by co-creating with our partners and community. Another work stream I'll mention is Care Connect, which is a relatively new program to HealthierHere, but not necessarily to King County or to Washington State. And Care Connect is a regional care coordination hub infrastructure that HealthierHere is building by working with local care coordinating agencies that have the care coordinators and CHWs who can connect community members who've tested positive for COVID with the services and resources they need to safely isolate and quarantine, and then also resources they might need beyond isolation. And how that is being done is by receiving those referrals from folks who've tested positive for COVID, assigning those to the appropriate care coordinating agencies and CHWs, who then assess needs and provide the support and connection to services and resources that are identified as needs for a specific client. And then part of our hub function is to sort of measure that impact of the program. So we see this work as, again, addressing community engagement and then also providing funding for this workforce that is culturally responsive and serving the communities that they're living in and where they've built that trust. Another work stream that I'll highlight as more of a future body of work for HealthierHere is our community hub. And this is work that we're anticipating as part of our Medicaid transformation renewal that the Healthcare Authority is currently applying and negotiating with CMS for. And this work is really around accelerating care delivery as well as payment innovation, focused on those health-related social needs, or as commonly known as needs related to social determinants of health. And this model is really building upon that infrastructure I briefly described related to Care Connect, so that the community hub is identifying and engaging with those patients in our communities who likely have several health-related social needs, building this partner network of providers and care coordinators who we can connect clients to, and then having them screen for those health-related social needs, and connecting clients again with those services and resources that they need, but also supporting those care coordinating agencies to do this work through outcome-based incentive payment, to really get at that innovative payment model. And then embedding in the process of follow-up and closed loop referrals, which we saw as such a need in the landscape analysis. And then lastly, tracking those outcomes and measuring the impact of this type of work. So again, this touches on some of the needs related to engaging community and funding a culturally competent and responsive workforce. So the last body of work I'll highlight is one that HealthierHere is just involved in, but one that we know many of our partners are working on as well, and an effort that is being led by Public Health Seattle and King County. And this is our the CHW Care Grant. And what this work has done is helped to strengthen the CHW workforce and help them to have the knowledge and skills and connections to provide the services and support as part of the COVID response. And part of that work has involved training a cohort of CHWs, resourcing the staff time to actually participate in training, promoting the value of CHWs in their work, and then actually contributing to the positions across the system of CHWs and full-time CHW work. So this touches on, again, community engagement, cultural competency, workforce, and funding, and wanted to emphasize this as just one of the things that HealthierHere is aware of in terms of what is going on in the community, and the work that our partners are doing related to care coordination. But we also know that it's just one small piece of what's happening. So we'd also love to hear about the work that your organizations are doing in King County related to care coordination and the recommendations that we've heard or areas of need that we've started to talk about today. So we are going to go into a different kind of activity, which I'll explain to you all, and I'll also share my screen so you can see what that's going to look like. So what I'm going to do is I'll put in the chat a link to a Google Slides activity that will look like this. And this is a sticky note activity that some of you who've engaged with HealthierHere in the past may have participated in similar activities. And what we're asking you to do is to share with us what your organizations are doing related to care coordination in King County. So this could be activities, investments, programs, strategies, interventions, advocacy, anything across the board that you're working on. And how you'll do that is I'll give you the link and you can go to the slide and you can just pick out a sticky note and start kind of typing in there what you're working on. If you see that another organization is doing something that you're also working on, you can go ahead and move a heart to it rather than creating another sticky note to indicate that you're also doing that work. So if sticky notes are filling up, you can go to a new slide and start working on different sticky notes. Okay, so I am going to put that link in the chat and we can get started. I also want to acknowledge, I know there are folks who might have certain technology limitations. So if you prefer not to engage in this way, or you have limitations to do so, please put your thoughts in the chat about what your organizations are doing. And we'll have a HealthierHere staff member copy those into a sticky note so that you can see them reflected. So you can engage in that way. So we'll have about 10 minutes of just a quiet work time, and I will elevate some of the things I'm seeing to you all, and perhaps ask for clarification if it's needed. And I see some folks are having to drop off, so appreciate the time. Thank you all. Okay, and seeing so some people having a hard time getting to the link. If you're having a hard time, go ahead and put the work your organizations are doing in the chat, and we'll have a HealthierHere staff member put those onto a sticky note for you. And again, once notes are filling up, feel free to go to the next slide and start working there. So seeing lots of great work, use of Unite Us, hosting resource connection days, sharing data, participating in Connect to Community Network, food hub and diaper giveaway program. These are great. Yep, and again, if someone else has put an idea or a strategy that your teams are doing, go ahead and put a heart on that sticky note to indicate that you're also doing that. And our first page is filling up, so go ahead and move on to keep adding your ideas. We've got folks using collective medical, providing resource lists, using philanthropy to create care coordination programs, investing in partnerships, collaborating with other CBOs, lots of partnership. It's great. Building referral processes, providing mental health workshops. Serving as a Care Connect Washington provider. These are great. Thanks everyone for sharing. And I'm seeing some great things in the chat as well. This is great. These sticky notes are just filling up. I love it. So please, as they're filling up, go on to the next one. We want to hear all the work that you're doing. So keep sharing. Providing trauma-informed movement and play. Great. Working with MCO partners to expand sustainability for home health services. Transition of care services. That's great. And I'm creating more slides because you're filling up all these sticky notes, so keep it up. We've got lots of folks that are serving on the or involved in the CIE, the Connect to Community Network in some way. Contracting with telepsych to help with collaborative care. These are great. Great. Going paperless. That's one we haven't seen yet. It's great. Food distribution. Providing MAT for houseless youth. This is great. We'll have a few more minutes, so please keep finish up your thoughts in the sticky notes and any lingering ideas or thoughts about what your organizations are doing. We'd love to have it on here, so fill out those last couple sticky notes or put your thoughts in the chat and we'll get them on a sticky note. Just a reminder, you can still use the heart functions to indicate if you're working on something that someone else is also doing. All right, so get your last thoughts in there. We're going to transition to a different question in just a moment. And seeing some folks that have to hop to other meetings, so thanks for participating. Alrighty, so I'm going to draw your attention, if you scroll on the left-hand side to slide 15, we're going to continue this activity with a different question up to focus on. So it's really great and truly encouraging to hear about all the work you're doing related to care coordination. And as we saw in the landscape analysis, there are gaps and areas that we need to focus on. So we want to hear from you what work needs to be done and by whom to continue to improve care coordination in King County. So go ahead and in those sticky notes, put your ideas about activities, interventions, needs, investments that are specifically not happening right now, or perhaps they're not happening at the scale or involving the folks that you think need to be involved, that would improve care coordination in King County. And so this time, if you see an idea or suggestion that resonates with you or you agree with, go ahead and use the hearts to place those on the sticky notes rather than creating a new one with the same idea. So we'll have about 10 minutes to think about what work we need to be doing around care coordination. And similar to last time, as sticky notes fill up, please move on to the next one and keep sharing your ideas. And of course, if you have ideas that you don't want to put on a sticky note, you'd rather engage in the chat, feel free to share them there, and a HealthierHere staff member will put them onto a sticky note for you. Great. So I'm seeing ability to share patient information between providers, building bridges between organizations, advocacy and education at the policy level. Great. Accessibility to medication and providers for all. Some legislation around licensing. Understanding and utilizing resources. More efforts around collaboration. These are great. Staffing and recruitment training. Thanks for sharing, everybody. And again, feel free to put those hearts on the sticky notes where you are agreeing or something's resonating with you. And as those sticky notes fill up, just move to the next slide and keep your ideas coming. Seeing access to health insurance and education on how to utilize it, gaining hospital buy-in, removing structural barriers to health access like immigration status, clear and consistent funding streams in non-healthcare settings, ability to track performance in real time. Great. More on unrestricted funding. staffing capacity to make sure referral informations are updated and maintained. Lots of great ideas around funding reform. Let's make it responsive to the person, not the insurance provider. Changes in the level of care that meet the needs of the client and patient. Great, and I'm seeing ideas come in through the chat, so feel free to keep using that. Culturally and linguistically competent services. Allowing those with lived experience to provide services. That's great. These are great. These are filling up, so keep moving down to new slides to keep your ideas coming, and take a look at others and put a heart on it if you want to emphasize that or lift it up too. We'll have just a few more minutes to get your thoughts and ideas on these sticky notes. Providing leadership opportunities for community members. It's great. Recognize that addressing social determinants of health means talking to CBOs and non-health providers. Access to non-traditional medical services. Funding competitive and livable wages. Definitely, especially in King County. Those are great. We'll have just 2 more minutes, so get your last thoughts on there, your hearts on those that resonate with you. Any last thoughts, go ahead and put them in the chat if you're not using the sticky notes. Alrighty. I'm gonna move us forward. If you're finishing up a thought, you can go ahead and finish that on your browser. I'm gonna stop sharing and take us back to our PowerPoint. Really, really appreciate your thoughts and your engagement in that activity, and I'm really looking forward to going through those more closely and seeing what you've all shared. And to let you know, I will go through all of those, clean up some of the slides a little bit, and I'll put that into a PDF for you and send that out with the materials after today's gathering, so that you can also have that record of what your colleagues and partners are doing, and their suggestions too for improving the system. So you'll have a copy of that. All right. So I'm going to wrap us up over the next 10 minutes, share about where we're headed with this care coordination work, and an opportunity to engage with us further. So when it comes to care coordination work, HealthierHere is going to be working on a care coordination strategic plan. And we want to continue to involve you all in different sectors in shaping that strategic plan. So we're going to be creating a care coordination transformation work group. And the intention is that this work group will be representative of various sectors, and that those representatives will sort of elevate the voices of their sectors and bring those wide array of perspectives to this work. We're hoping to have representation from a large CBO, a small CBO, an FQHC, a hospital, BHA or behavioral health organization, tribal-led or tribal serving organization, managed care representative, a government representative, and then 2 to 3 consumer or community members represented in the work group. So the work group not only will help shape that strategic plan, but will also inform the content and feedback cycle for future broader partner engagements similar to this one. And work group members are intended to be compensated, and details of that are still in process. To provide a little more context, what we mean by helping shape that care coordination strategic plan is that work group members are going to work closely with HealthierHere to understand the current strengths of care coordination in King County, understand ongoing gaps and where we need to focus energy and capacity. So similar to what we've been building understanding around today, while also understanding our collective ability in King County to influence these gaps, as well as the current and anticipated work around care coordination, and then also help us understand how we can continue to support partners in doing this transformative work. The work group members can expect to meet about once a month, and there will be a certain amount of pre or post meeting work. So that can you can consider that to be a time commitment of about 3 to 4 hours per month. So if you're interested in joining that work group, we do have a Google form, which I will put in the chat for you all so that you can access that. It will also go out in the slides with the today's meeting content. So I'm going to pop that in the chat for you. But if you don't have a chance to grab it, you can look forward to getting that link in the follow-up notes from today. So if you're interested in joining the work group, you'll fill out the Google interest form to just provide us a little more information about where you're coming from and what kind of sector you'd be representing. HealthierHere will review those submissions the first week of November. So we ask that if you're interested, please get that submitted by Monday, October 31st. And then we'll let you know if you've been selected for the work group by November 15th. And the first meeting will be held on Tuesday, November 29th. So again, fill out that interest form or feel free to forward it to someone you think might be interested if they weren't able to make it today. And if you're not interested in joining the work group, but would like to still remain engaged, there will be future opportunities to continue to plug into this work. So as we look ahead for care coordination work, we're currently in October, and this has been a time for HealthierHere to engage our partner groups in discussions like the one we've had today, and to start this search for this work group. And then as we go into November, we'll have our first care coordination transformation work group meeting. We'll break in December for the end of year wrap up and the chaos I know we're all bracing ourselves for that comes with December. And then as we head into 2023, the work group will meet monthly, like I said, through the summer. And then you can look forward to all partner gatherings in the spring of 2023 and sometime in the summer as well. So plenty of opportunities if you're not interested or can't participate in the work group, and there will be future chances to continue to provide feedback and hear what we're up to. So that is all I have for you today. And just really appreciate your participation and thoughtful engagement. So what you can look forward to receiving from me after today is the slide deck, which will include some themes from your breakout discussions, the PDF of the sticky note activity, as well as a Google form if you're interested in letting us know that you'd like to participate in the work group. And then this session has also been recorded. So I'll be putting that on our YouTube page so you can access it there or send it to colleagues who weren't able to make it today. So that's what you can look forward to. I'll get that to you all no later than the end of this week. And I'm happy to give you a little bit of time back or to stay online for a few minutes if folks have questions. So, thank you all.
Fantastic. Thank you so much, Madeline. And thank you to everyone for your participation. Have a wonderful day. Looking forward to getting the information and then sharing it back out with you. Be well, everyone.